So hi, everybody. As Leslie Newbold said, I am Leslie Fry. I'm the upper school psychologist here at Springside Chestnut Hill Academy, and I'm very honored to introduce this person today, not only because I know her very well and she's a family friend, but also because she's part of the same sorority as I am, Alpha Kappa Alpha Sorority Incorporated. And I'm just so excited for the things that she's going to be talking with you guys about. And I'm proud to know her. So without further ado, I'm going to talk a little bit about Dr. Kelly Moore. Kelly Moore is a licensed clinical psychologist in New Jersey and Pennsylvania with expertise in cognitive behavioral treatment for youth and adults struggling to cope with various forms of anxiety, depression, relationship challenges, trauma, and postpartum onset disorders. In addition to her full-time position as a program manager at Rutgers University, Dr. Moore is the owner of Moore Wellness, LLC, a mental health training and consulting company, and shares information about mental health on her blog, The Well Family Spot. Dr. Moore received her Bachelor's of Science degree in Human Development from Cornell University, a Master's of Science and Education degree in Psychological Services from the University of Pennsylvania, and her Doctorate of Psychology degree in Clinical Psychology from Rutgers University. Dr. Moore has over 17 years of experience working primarily with children in community mental health settings and a private practice, and is dedicated to the belief that emotional health and wellness is not a privilege, but a right. Her philosophy is that everyone deserves to be well, and with the right support system, they can unlock the tools within themselves to maintain wellness throughout the lifespan, which I totally agree with. Without further ado, here is Dr. Kelly Moore.
Thank you so much, Leslie and Leslie, for inviting me to be with you all tonight. I hope you can hear me okay. As we said, technology can sometimes present challenges, but we're just going to, hope that everything goes off without a hitch tonight. And I'm going to start to share my screen and just give me a thumbs up if you can see it. Thank you. So I am so excited and I'm so grateful to have the opportunity to be here with you tonight. I have about 20 minutes or so to share some content with you, and then there'll be some time for questions. So feel free to use the chat. Leslie will be looking at it as we go, and I'm happy to answer questions as we go along. So I purposely titled this Managing 2020 Stress, Sadness, and Anxiety because if we're being honest, I could do a topic like this any year, but I think there's something very unique about 2020, and I don't have to tell you all that. I'm going to do my best in this presentation not to use the phrases that we're probably all sick of hearing, like unprecedented, new normal, but I can't promise you it's not in there. But I think those are the words that really capture where we are. So there's something unique about this year. And so I'm here to not just talk about how I can help your children, but also you as a parent, as a community member, as someone who cares about someone else. I think this can be helpful for all of us. And even as I talk to you tonight, I'm always reinforcing these things within myself. But just to set the context of where we are, I just thought it was important to talk about when I say anxiety, what am I talking about? Because anxiety is a word that's so often used. And so there's sort of in normal situations, anxiety really consists of these three components that I think is really important to think about. So the first one is when someone has an intolerance of uncertainty, like there's a constant thought about what if this or that happens. So there's this what if where people tend to be either constantly thinking about what's going to happen or they're worried about what already happened and how it's going to affect the future, but they're not really in the present moment where things are very certain. So they have this sort of preoccupation with not knowing what's going to happen, and that creates a lot of intolerance, and that also creates a lot of internal distress. And then the other piece of anxiety is overestimating threat. So thinking that if something did happen, it's highly likely that it's going to be bad and not positive. It's really this inflexibility of thinking about what if the possibility of what could happen is positive. It's just sort of this tendency to focus on the negative. And then the last piece is that if all these things happen, that I'm not going to be able to handle it, that it will completely overrun my ability to cope. And people with anxiety and even people that suffer from depression tend to have this underestimation that they'll be able to cope with things that happen in their life. So these three things taken together will make sense as I'm discussing how you can then deal with stress and anxiety, whether you're young or you're older. So the current stressors that youth and all of us are experiencing, but I think our youth are experiencing in a very different way, is we have the COVID-19 crisis, this pandemic that we're dealing with. And I'm going to talk about how it may even feel like a traumatic event or it may trigger depressed like mood. But also there's these components that are happening also in context with COVID. So we have school uncertainty. We were in a hybrid model in many places. Now I'm from New Jersey, so if I say something different than maybe what's going on in Pennsylvania, forgive me. But I know we're going through similar situations where there were hybrid versions and some people were all in school and this school district was doing this and this school district might be doing that. And so the sadness about losing social interactions that would have been normal. Even when kids were coming into school, it wasn't school as usual. And so there's been this shift in what what they would normally expect in their school year. And so with that comes a lot of frustration and sadness. And for our older kids, like teenagers, where so much of their world is around, being able to date and hang out with their friends and go to graduation, homecoming, and things like that. When all that's kind of removed from the equation, they have to find a way to cope with that, and it can produce a lot of sadness. But then also none of us exist in a vacuum. We're living in a situation right now where we don't maybe feel like we live in the United States of America, but the fragmented states of America. And we're very divided as a nation. We've seen this increase in discussion around racism and systemic oppression. We've seen that the social and political climate is really fractured and disruptive. And it's really hard to escape all of these things. And it just feels like everything's happening all at once. So while in some ways what's been going on has highlighted areas where we really need to grow as a country, it still doesn't change the fact that it's very stressful. And just in relation to why I said COVID-19 and the pandemic is kind of like related to traumatic and depressive like experiences for people, is because it's outside of our control, and that there's an aspect of it that kind of feels like a natural disaster. It's kind of like, being in a hurricane. It's sort of widespread impact, but there's kind of senseless loss attached to it. It doesn't seem to make a lot of sense. We have some sense of who's more vulnerable, but then we hear stories about people that are outside of that element that are also impacted. It's very subjective. So even though we're all going through the COVID-19 pandemic, there's a lot of variability in how everyone experiences it. Even people that have had COVID-19, there's many different versions of their experience. And so there's something about it that feels a little bit out of control and reckless. And that creates that feeling of unrest because you can't seem to predict what's going to happen. And people in general tend to just thrive when they know what's going to happen. And it makes us feel really powerless because we're doing all we can do, but it's still not enough. The numbers keep going up. And so understanding that context might give you some insight into why you might see certain symptoms in your children. So I'll talk first about typical symptoms of stress and anxiety in children or youth. And when I say children, I'm talking about that 0 to like 20, because we know our adolescent minds are still growing and developing well into college age. So this is not, when I say kids, I'm not just talking about the little ones, but and then I'll talk about symptoms in adults as well. So in our youth, we might see a lot of different things depending on their age. One of the things I know from my work is that younger children tend to express stress and anxiety more in terms of physical symptoms. So these are the kids where they spend a lot of time in the nurse's office and my tummy aches, I have a headache. They'll describe just like general malaise or pain in their body. They have all these physical symptoms of anxiety, and that's how they let you know that they're feeling stressed out or anxious. That's one way they may show you. You may also notice that your kids may be worrying a little bit more than usual. So are they constantly asking you about things that haven't happened yet? Are they constantly asking you to check in on other family members more than usual? So anytime that you're concerned about your children, you always want to compare it to their normal behavior pattern. So if it's more than what they would normally be like, then that's when you might want to, have your eyes and ears open that there may be something else going on. This third point is one you could really miss: reassurance seeking behaviors. That's one of the hallmark symptoms of a number of anxiety disorders with youth. So what that looks like is asking a lot of questions to make sure everything is okay, or that they have control over everything. So it's, where are you going, mom? What store are you going to? Who's going to be there? When are you coming back? And when you come home, did you wear your mask? Did you wash your hands? Did you do this? Did you do that? They want you to answer a lot of questions to give them the reassurance that everything is okay, but it's excessive. It's more than what you would normally expect from a child. And so sometimes as parents, we're inadvertently answering those questions. And in some ways we're reinforcing that kind of reassurance seeking behavior, which reinforces their anxiety. So they have to kind of build trust to know that we're keeping them safe as best we can. And that also we don't have to have all the answers for them to feel safe. Another thing you might see is clingy behaviors. This is typical of younger kids, but we may also sometimes see this with older kids, where they are fearful about leaving you or you leaving them, especially with everything that's happening right now with COVID. Are they having sleep disturbance, nightmares? Rigidity and inflexible behaviors is another big one that's a sign of anxiety, because when I feel like the world is completely out of control, my survival response might be to try to make things more under control. So I'll try to control this little piece over here that I can control. So that might mean I'm going to arrange my plate a certain way, and I can't have my food touch this food because this is how I have control over here. Or I don't want anyone to touch my space where I do my schoolwork in the house, and it has to be a certain way. So this kind of rigidity is really in response sometimes to feeling like you don't have any control everywhere else. So you try to find it somewhere, and it can just be a little excessive. And moodiness is always something you should be aware of. Like, we know our children's baseline mood. Some children are naturally more moody, but if you know that about your child, you would then notice if it was more than usual. And as schools start to shift back to virtual learning, we may see that increase, especially for our older students that are knowing that this might shape or change the way they're going to have that senior year, or that, first year of college, or that kind of thing. But what about us as parents? I have 3 young children. They're 12, 8, and 3, all boys. I've been home with them since Friday, March 13th, and working. And if you can hear it in my voice, I'm practicing a lot of this stuff here today. I'm always thinking about, how is my stress affecting my children? And so we're not immune to stress as parents. But what that looks like in us is that we might be doing too much information seeking ourselves. And this is sort of a mirroring of that reassurance seeking that children might do. We might go watch the news all day long, or have notifications coming to our phone all day long, because we have to keep up on all of what's happening. And we have the COVID app to see what the new numbers are. And we're kind of looking at it all day to make sure we're very well informed. But ask yourself if that actually makes you feel more informed, or does it make you feel more anxious? Or are you feeling like, if you don't know, that somehow something bad will happen? What about your own emotional distress as you're dealing with, all of the balancing that we've had to do with work and helping our families, helping our children, making sure that we're trying to create some level of normalcy for our kids. We may be experiencing sleeping challenges, mood changes, being overly protective of our kids, or if we had a pre-existing anxiety or depressed mood symptom before, maybe it's worsening. Have you lost interest in activities that you used to enjoy that you can actually still do, but you just don't want to do them? And then being aware of changes in how we're parenting our children. Have we shifted, and is the pendulum swinging to being too permissive because we feel so sorry for what they're missing out on, to being too rigid because we're so scared that if they step one foot out the door, they're going to contract the virus? So we have to be aware of our own symptoms in addition to our kids. But also, before I talk about how you can help your kids, what about why these symptoms have increased, right? Why are we seeing this increase happening? Because it is happening. We are seeing more and more people wanting to come into treatment because of this increase in depression and anxiety in youth. Well, in terms of the focus in the country right now on racism and discrimination, we know from research that anxiety among Black and Brown youth is increased when there are repeated playing of videos of Black and brown bodies being killed at the hands of police officers, or when there is a lot of discussion about racism and discrimination, it does increase anxiety among Black and brown youth. The pandemic has changed pretty much almost every aspect of our daily life, including social experiences for youth. And for kids that are more anxious or already were anxious, they probably liked things a certain way and they really thrived on structure, which school provides sort of inherently. But remote learning does require some level of flexibility and creative approaches that sometimes is really difficult for kids that are more anxious to like flex their thinking. And so we have to be aware of how to make it easier for them to do it. And that increased access to news and social media updates about what's going on in our world and in our nation may just cause a general feeling of like, what is going on? There's no control here. And then add that part about COVID. You know, how many of us have experienced a loss or had to attend a virtual funeral during this time? You know I've attended several as a result of the COVID-19 pandemic. So all the loss of life, loss of traditions, we're going into the holidays, we may not be able to do them the same way. It just kind of feels unfair. I know that's kind of a not the most academic term to use, but unfairness and a general feeling of, you know, I can't control anything right now and I feel so vulnerable. That's why we are feeling that increase in symptoms and noticing more and more of that amongst ourselves. And so what we can do to help, and these are really small things, but they go a long way. So the way you can help youth manage this stuff is, one, we have to give them information that's age appropriate and true and factual. Now I know now we live in a world where no one seems to think they know what the truth is, but there are certain things that are actually true. And that's what's happening right now in their world. And so we need to think about, can we find age appropriate news resources for kids? I love Scholastic News. I think it's a great outlet. A lot of schools use Scholastic News, but there's a number of kid friendly news shows and websites where they can learn about things, not just about what's going on in the world, but also about how to cope with stress. And also talk to them, find out what they're already finding out. I mean, sometimes my 12-year-old will tell me something he heard and I'm like, where did you hear that? And he's like, oh, I'm playing Xbox and my friend said this, that his mom said. So they're going to get information anyway. Don't freak out about it. Just ask them what they've heard and then try to give them the actual information so that they're getting the truth. And also focus on what they can control. So create routines at home. I can't stress this enough. Having any kind of routine to your day just builds in some level of, at least I know this part of my day is going to go the same every single day. So whether that's their bedtime routine, your morning routine, whatever it is, or that every Friday you're going to get pizza or make pizza together as a family, that can help to kind of build in a little bit more of a sense of control over what's happening. Create a comfortable learning area in your home. Follow the CDC guidelines. You have control on whether or not you wear a mask. Like that's one thing you do have control over. It may not seem like a lot, but it's something you get to do. And I think using that kind of language is you get to be in charge of whether you're going to wear a mask. You get to be in charge of, you know, putting your school items away at the end of the day and walking away from that school area where you do your work. And now you're out of school and you're living your life. So kind of creating more of a focus on what they can control is important. And then we have to empower our young people to use coping strategies, because parents, we cannot fix this. Like we can't do anything about this, and we can reassure them and we can provide a lot of hope. But our best bet right now is to teach our kids real time in the moment. This is how you cope when you have no control over what everyone else is doing, right? So have them write in a journal, because somebody ought to read what happened in 2020 from their perspective. And they're going to have, this is their, you know, I walked 12 miles in the snow story. This is going to be their story for their grandchildren, only it's going to be true. Like this really did happen in 2020. So, you know, ask them to try meditation. There's all kinds of great apps for doing meditation. I do it with my kids. They really love it. One I use is like Stop, Think, Breathe Kids. I really love that app. It's a lot of fun for even little kids. My 3-year-old does it. Doing virtual game night, and then engaging in age appropriate activism. If there's a protest somewhere, you know, that was happening in the summer where we took our children to a protest, because there's evidence that shows when kids feel like they can get involved in their world in some way, it actually reduces their anxiety. And then as parents, we have to set boundaries for ourselves. So turn the news off. I only watch the news from like about 10 to 11 every night. And after that, I do stay up late. So I have a few hours after that where I'm still doing things. But I would say try not to watch too much news all day if it worsens your anxiety. If you can handle it, fine, then handle it. But try to set some boundaries for yourself. We're working more than we're supposed to. That's been shown a lot too. Have a set time where you're going to stop working and focus on what you can control. Talk to your children's teachers, find out how you can help your child at home. Follow those guidelines as best you can. I know they change a lot, and one day it's 6 feet, then it was 7 feet, then it keeps changing. But the most predictable thing right now is the change. So if you can anticipate that things are going to be unpredictable, that allows you to be flexible and meet that with some kind of sense of embracing it as opposed to running away from it. And just focus on your own family. Don't compare yourself to other people. That way you don't end up judging others for their decisions and being upset about what others are doing, but also you don't really care if other people are upset about what you're doing. Like by focusing on your own family, that's the best way to go. And then try to use coping strategies yourself, the same ones that you would use with your children. Do it together. And I added this one on the bottom right about watching old shows and films you used to enjoy as a way to reduce stress, because when you watch reruns of shows you really like that are still entertaining, you already know what's going to happen. There's something sort of comforting. I mean, why did they used to have Nick at Night? When I was a kid, I used to watch Nick at Night. And, there was something very comforting about watching these like shows at night that, had already been on before. And, I'd watched it enough times and then I knew what was going to happen. And to this day, I still will watch old reruns because I think it's a way to feel like there's something that I know is going to happen in the world, right? So you see that like sort of theme throughout a lot of what I'm talking about. So just some final points and then we'll open it up for questions is, first of all, know the difference between fears that are and are not actual and then act. So we know that there's certain things that are real that we can't fix. And I would really caution you from kind of reassuring your children by saying everything's, no, it's fine. It's fine. Everything's perfect. It's not, everything's not okay. Right. We know we have a long way to go. And things don't feel okay in the moment, but reminding them that right here, right now, today, at this time, on this date, they are home with you, they are safe, and that, you guys are doing everything you can to protect them and keep them safe, and that the things that you're doing are helping others to also be safe by wearing your mask or by staying home or that kind of thing. And we really just have to give them the tools to cope. This is the chance where they can really practice new skill sets on how to cope and manage. And just remember that anxiety is really rooted in this lack of control and intolerance of uncertainty. So there's ways you can build in some certainty in your day-to-day at home, but you really want to teach them how this is a chance to practice staying in the moment. Yesterday already happened. Tomorrow, we don't know what's going to happen, but we can focus on what's happening right here and right now. It's a really great life skill in general. And I think it helps to build up a sense of tolerance, but also just being more appreciative of the moment and really grateful for the time that you do have. And then make decisions for your family and withhold judgment towards your neighbors with the intention of protecting your community. So just know everyone's doing the best they can. That doesn't mean everybody's doing everything right or wrong. Everyone's just doing what the best they can based on the information they have. And even if you don't agree with how others are handling things, try to withhold talking about those things around your children so that they don't then think it's okay to judge everybody else. So really just focus on your own family and the context of keeping your community safe. And that helps to also just make them feel a little more reassured and also empowers them to think about ways they can continue to protect their community by following all these guidelines. So I want to just thank you again for having me. I know I probably went over my 20 minutes, but I want to just wish you the best for the rest of the school year, whether it's in the building or a little bit at home or a little bit of both. And I'm going to stop sharing to see if there's any questions, but thank you again for having me.
Thank you so much, Kelly. I mean, it was so informative, even short and sweet, but so much information in that was very appreciative of. So we do have a few questions, and obviously we have time for more if people start to think of some as Kelly answers these. The first one is, How can I help when my child is having an anxiety attack?
That's a good question. So when people have, we call them panic attacks, when they're having like a lot of physical symptoms, shortness of breath, or they're sort of feeling like they can't get control of their breathing and their heart rate is really speeding up. The one thing you don't want to do is don't say like calm down, because they're trying, right? They can't, and that might actually make people feel like they're doing something wrong, or something like that. So I think what you want to try to do is, especially with kids, because kids respond very well to like a mirroring type of process. So if children are very activated or triggered, a lot of times a good way to bring them down is to then change your affect to where you want them to be. So it may mean that you come lower eye to eye with them, that you start to talk slower, that you start to just model for them. So you start to take deep breaths, a deep inhale, exhale, and you start to have them like, do what I do, do what I do. Maybe have them put their hand on their heart so they can feel it slowing down. You can say things like, you're okay, you're okay. Barring that your child doesn't have like a medical condition, right? So they don't have asthma or something where you would need to be concerned and you're really certain that it's just anxiety. You're okay, you're okay. And once you can get them to kind of mirror what you're modeling, what you may want to do is remove them from whatever situation was the trigger. So let's say they were doing schoolwork and they didn't understand it, or something like that. Like stop for a little bit and come back to it, but always go back to it, because you don't want them to think that the way to cope with anxiety is to avoid. So you can take a break, but then bring them back and sort of say like, okay, now that you're calm, let's come back to it and let's figure out what was going on. So you're kind of problem solving, but you always want to make sure you take them back to the triggering event. If it's, something like that, because you want them to know that they should approach things, even if they're a little anxious, they can approach it and use those same skills.
And how much does diet contribute to anxiety?
That's a good question. I'm not a nutritionist, but I would imagine that there are things, like there are foods that, if your kid is a big snacker and just eats a lot of junk food and doesn't really get well hydrated, we tend to do better when we have energy, that good energy in our body. So if you have like a teenager that just kind of lives off of coffee all day long, they're sort of like little adults, probably will promote more risk for being more anxious. So I think having a balanced diet is always going to result in a person feeling better. I think sleep is a portion, like just related to that. I think sleep is underestimated in terms of how restorative it is to your body's ability to regulate emotion. So I think in combination, diet and sleep are definitely important to think about for any type of mood regulation.
And then real quick, I saw in the chat, are you able to share the slides with us? And
Oh,
we
yeah.
talk to
Mhm.
people.
I can send it to you.
And then you mentioned trauma. What signs should we look for or be concerned about for long-term trauma?
Related to COVID, this is like the question of the year, right? So we don't know what is the long-term impact of what our children have experienced. I have to say though, I actually think the kids are all right, if I can use like a phrase like that. I think kids are very resilient. I noticed that even, my kids, one of my kids plays soccer and, they've been wrapping up, but I noticed that the kids actually can eye up 6 feet now. Like they can actually see it and kind of like take the step back, and they're sort of making these adjustments in real time. Whereas adults, we remember a lot of life before COVID, where the younger these kids are, they don't even remember. Some of them, they're not going to remember a lot of life before COVID. But for the ones that do, I think the long-term impact of it may be things like the change in the way we are with each other during cold and flu season or things like that. But when we talk about trauma, when kids have fear about sickness or things like that, we may see more kids like that have more fears about contracting COVID and colds and things like that. And so I think, again, anytime you're looking for anytime it's more than what you would typically expect from a child that age or how they used to be, that's when you want to have that red flag up, to kind of take a look a little closer. But many kids will, I think, bounce right through this situation, because I think children just have a natural resilience, that's just a little different than adults. Doesn't mean that they're all going to be perfectly fine and get over it per se, but I don't think the long-term harm, is as sort of fatalistic as I think it's been talked about here and there.
And for teenage boys age 13, how do you handle a kid who wants to be alone in their room most of the day? The parents are both working, so it's hard for them to monitor it all, but their son does not have much interest in hanging with the family.
So 13 is that age. I have a 12-year-old. They don't, I encourage anybody who is worried about their kids' behavior to just ask yourself, like, how would it be without COVID, right? So at that age, developmentally, like, kids don't really want to hang out anyway, right? So they don't really want to be around us anyway. So I wouldn't be too worried about that unless you had a fear that they were experiencing depression or anxiety or something like that. Then in that case, I think it would be, you can meet them halfway. So maybe they want to be in their room, and that's fine, but leave the door open so that I can kind of do a walk by and just peek in, like, hey, and see what's going on. So like that sort of compromise and give and take might help, with helping your child to know that, yes, we respect you want to be alone. You're 13, you're kind of moving into manhood, I guess, at 13. I don't want to think that that's true, but I guess it is. But that I'll meet you halfway, but you got to leave your door open. You have to, so there's like a give and take, which I think is just a good life skill anyway, to teach them that they can have certain things, but they can't have everything. So setting some boundaries with them, I think, is important.
We have another one. This is great. Thanks.
Oh, thank you.
I have a question. What about when some neighbors regarding COVID aren't doing the best they can? They seem like they are kind of ignoring the guidelines, getting together without distancing or masking, and your kids notice this and ask you about it, and you have to reassure them of the actual guidelines. Isn't it sometimes important to let them know they can make practical judgments and that it's okay to know that everyone is similarly doing the best they can on these things? And then following up, the context is when the kids themselves are anxious about COVID and trying to make sense of things.
Oh, okay. Yeah. So, so I guess a qualifier of what I said is that there are some people that are not. I think it's more of like making the assumption that people are doing things based on whatever their comfort level is. And so with kids, I mean, first of all, I think as a parent, sometimes it's hard on us because we have to then set a boundary with our kids that to them doesn't seem fair if the kid across the street is doing whatever they want. So, one, I think, in some ways we have to accept the fact that our kids may be unhappy with our final decisions, right? So if you can tolerate, we have to build our tolerance for our kids not really being happy with us and our decisions. But if they're saying, well, how come over there they're doing this and we're doing this over here, it goes back to, so this is our family and this is what we're doing, and this is what, this, you can show them, like, this is where it says this, or if they're a little older, if they're younger, it's just, this is what being said is the correct way to kind of reduce the risk of COVID. And this is why we're taking care of ourselves. And they're over there doing that. And they may have reasons why they're doing that. But I think it's important how you say it so that it doesn't sound like you're judging them, even though maybe in your head you are. We don't want to model that. So I think you can say, like, well, they're doing that over there because that's their family, and see how their house is green and our house is blue. Like, we do things differently over here. And it's not better or worse, it's different. And that's how it's going to be. Now with older kids, you can maybe get into it a little bit more, and tell them that, this is what our family's doing, and it's just for a short while. And Leslie will know where I'm going with this, but we we had an uncle who has since passed, but he counted his life in days. And so I've adopted some of that mindset through this, because I keep telling myself, like, I've been alive for so many days, and I've just had these little bit of days where I've had to change my lifestyle and be so quarantined. And when you do that comparison, it never is going to equal, right? So the amount of days that these kids have ahead of them and behind them, this is just a short time that we're doing this. And I think reminding kids, you've been doing this for 4 months, but you've been alive for like hundreds of months, right? So like, I think it's just reminding them of where they are in time and space. They really don't have that concept even when they're a teenager. So I think we're trying to get them to think about it like that, keeps them grounded so that they can, tolerate that they may not be able to do what the neighbor is doing. I hope that answered the question. I'm not sure, but.
That's a good point though. It brings me back to a good memory.
Yeah.
When a child is in clingy or controlling behavior, is that something to try to help move them out of, or is it good to understand and just walk with them in those?
Yes and no. So I think it depends on how clingy they are. I think this is a time when we're kind of holding our family closer, and it's not so bad to have them want to be with you, that they're trying to figure out how to cope. And some of that might be the controlling clinginess. I think if it's stopping you from going to the store, or like stopping you from going into the next room, and like you turn around and you're bumping into the kid, I think that's when you might want to, start to create some space between you. Because if you think about it, when kids get overly clingy like that, it's because they don't trust that they're going to be safe or that you're going to be safe. And so building that trust is built by them knowing that if they're away from you, they can be safe.
And when we do return to outside life, how should we prepare our kids to prevent anxiety?
It's so hard to prevent anxiety. I think it's really about moving through anxiety. I think we all do that every day in some way, if we do have to go out. And so when the way, I guess, to prepare kids to deal with anxiety is some of those things I mentioned. So it's being aware of what it is they're anxious about. So building their own sense of awareness, but I think also giving them strategies. So when you go out, make sure you're doing all the steps. So wearing masks, and I don't know, the wearing mask thing might be here for a little bit. We don't want to believe that, but I think we have to come to terms, first of all, with what the reality could be. And then just saying, like, this is the way it is. And so there's the part that you can control and the part you can't. So make sure you're just dealing with the parts you can control. And if something, God forbid, something happened, these are the things that we're going to do to make sure we're taking care of you. So we have doctors, and we have this, and we have medicine, and, kind of reassuring kids. But I think the news thing plays into this too, because, what comes on the news is the most eye-catching stories. So I think our perception of the COVID-19 experience, and even COVID testing, like how some people don't want to get tested because they were seeing like this reports about, they go all the way up to and I've gotten COVID testing a couple times just to kind of tell myself, like, I can do it, like just to practice it. If I'm telling other people to do it, I wanted to make sure I did it too. And it wasn't what I thought it was. And had I gone by those reports, I wouldn't have wanted to go at all either. So I think it's important to remember to teach our kids that what they see on TV and the news, just like when they're on social media looking at these influencers, like what you see isn't always the real thing. And when people get COVID, they may have a lot of distressing symptoms, but there's all kinds of ways that they can help to manage those symptoms. And many people do recover. It's still very serious, but reminding them that we're not going to see the person that had a really, really bad flu-like cold and had to quarantine for 14 days and then we're done with it. We're not going to see those stories. We're going to see the really scary stories.
These are all such great questions and answers. Right now, I think we've answered all of them so far. So we still have a little bit of time left if anybody wants to bring anything up in the Q&A or the chat. Leslie,
I did realize why Hallmark is at an all-time high, because it's just so predictable. It's the same formula, and everyone just loves it.
Yeah. The holiday movies are probably going to be a big hit this year.
Yeah, we know the ending. That was great advice, to watch old shows. And I don't realize, like, my kids are doing that. And I That must be one of the reasons. It might be their 5th time through The Office.
I was just gonna say that's been my go-to show. I watch it every single night on Netflix.
It's so good. It's so funny.
I watch Parks and Recreation on the Peacock thing that started just recently, but I
Oh,
watch Parks and Recreation too.
So that was great advice. And creating structure too. I really like that as much as you can.
Yeah.
Routines and structure, predictability.
Yeah.
So, yeah. Do we have any more questions?
Yeah. Are there suggestions that, thank you so much, Kelly, for such helpful.
Thank you. It was so great.
Are there suggestions that generally make for schools to help kids deal with COVID and managing anxiety?
Well, I think what the school here is doing right now is like, I was talking with you both about all the things that you're doing, doing things for staff, to support staff. I think when staff feel supported and they can kind of, have a wellness moment, or something like that, it kind of helps them to feel like they can do that for the kids. I think we tend to have like these parallel processes where, the staff, how they feel, it bleeds down into how they are then with their students. And so things like this, like having these kinds of forums and opportunities to talk about these issues, they're not they don't fix everything, right? And again, we're not going to make all this go away, but we can build we're resilient. I always go back to that in my own mind. Human beings are built to last, that's why we're here. So as hard as this is, and we all may have been touched in different ways by this. And every time I see those numbers at night on the screen, I'm like, those are not numbers, those are people, right? It hurts. But at the end of the day, we can be resilient and bounce through this and be different on the other side of it. Yes. But I think things like this help us to realize that things we can manage better. So I think having forums like this and fun activities and the wine events and things like that, these are all fun ways, I think, to kind of create some sense of normalcy, because we have a long way to go to get on the other side of this.
It's all about the little joys and finding gratitude.
Exactly. I just did a blog post about gratitude, in fact, because I think gratitude is that one thing that does keep you grounded, because it kind of tells you, what do I have to be thankful for right now, right? Even if it's just, I woke up. Like, if that's all you got, that's fine. That's okay. It doesn't have to be like this very deep, fancy way of thinking. It's just, I'm grateful I have this glass of water next to me. I have some water to drink, that kind of thing.
Yeah.
We have another question. Do you believe that limiting our children's time on social media can reduce their anxiety? Thank you.
I do, but good luck trying.
Mm.
I almost feel like even before COVID, it was a problem, right? It's that's that problem, because for them, their social media is like capital, like their social capital. It's not like, when I was younger and you really had to be around people to like have that interaction. So I think you could try to limit it by doing things to pull them away from it. So I know in our house, like every Friday and Saturday night is family movie night, and they have to put everybody has to put their devices away to have family movie night. And so what we did is on Friday night, it's an old movie from my husband and my era that they have to watch. And then Saturday night, they can pick something that's newer and more updated. So we watched like the old version of The Witches, like and Hocus Pocus, and stuff like that. And then they pick something that's current that, we can get into. So I think if you build stuff like that in, then over time you might start to notice they'll be more engaged. But I think it's hard to pull them away from social media when they can't really do a lot else. So I think just asking them what they're doing. I asked our son if we could get on his TikTok when this first started, would he let us like guest star on his TikTok, and we did like a little family dance on TikTok, and I was like so excited. And so I think you can find ways to infiltrate in some way so how they're using it.
Yeah.
He didn't ask us to come back since, but we did get that one video, and that was it.
I'd like to see that.
Yeah, it was fun. It was fun.
Cool things, exactly. Few minutes left.
see any more in the chat, so.
A little bit longer. Well, thank you everybody for today and for coming and attending.